The White House says voters should not trust a new report on the Senate Republicans' health care bill. The Congressional Budget Office estimates 22 million more people will be uninsured by 2026 if the Senate bill replaces Obamacare. That number apparently convinced another senator to vote no. Susan Collins is the sixth Republican to come out against the plan. Senate leaders can only afford to lose 2 GOP votes. Nancy Cordes is on Capitol Hill. Nancy, good morning.
Good morning. And because of that growing GOP opposition, the bill may now not come up for a vote this week as planned. Several of those Republicans are saying that they will block attempts by GOP leaders to bring the bill to the floor as early as today. They view those CBO numbers as proof that this legislation needs a lot more work.
I think if you were on the fence about the bill, the CBO score did not help.
South Carolina's Lindsey Graham was sounding pessimistic last night, and he's likely to vote yes. His colleague Susan Collins announced she's a no, tweeting 22 million people lose insurance. Medicaid cuts hurt most vulnerable Americans. 1 in 5 residents in her state is on Medicaid. According to the CBO report, the GOP bill's steep Medicaid cuts would force enrollment down by 15 million Americans over 10 years, reducing the federal deficit by $321 billion. Many Republicans say that's a good thing.
These programs are growing at an unsustainable rate.
As for Americans in the individual market, average premiums would be about 20% lower than under Obamacare. But some Americans would receive smaller tax credits, meaning many would end up with higher out-of-pocket spending on health care. Hit hardest would be older, middle-income Americans. A 64-year-old making roughly $60,000 a year would go from paying about $4,000 a year to $16,000 by 2026.
No matter how the bill changes around the edges, it is fundamentally rotten at the center.
The CBO estimates that under the GOP plan, 15 million people would drop off coverage next year, primarily because Obamacare's penalty for not having insurance would be eliminated. GOP supporters argue the government shouldn't force people to buy insurance anyway.
That's not denying somebody coverage. That's a choice by them to drop coverage they already have because they don't have to pay a fine.
Pulling this bill even temporarily would be a setback for the White House, which is slamming the CBO, saying that the nonpartisan office has a history of inaccuracy. The president has been working the phones, calling undecided Republicans, and the vice president is sitting down for dinner with 4 of them tonight, Norah.
Breaking bread. All right, Nancy, thank you so much.